Today, I'm so excited to have Adriaan Louw here today to discuss a few topics of interest for those that are interested in pain, and also some of the upcoming events and how you can get involved, and perhaps a nice little prize for those that actually listen to the entirety of this interview. Adriaan, I actually wanted to chat with you and stem off of my experience today, as I do anesthesiology Tuesday through Friday, and I happened to go help out I won't say any names, but I went to a pain clinic that does sedation for procedures, little outpatient procedures. Interestingly, there are mid-levels that help with taking these patients in, and sometimes, and inevitably doing some education because sometimes they don't have time with the physician to understand some things. But it was very clear that there's some misunderstandings of just what pain is, how it serves us, and the fact that there's a lot of expectation that these little procedures are going to fix them. We know that that's a very limited view of what's out there. But what I found fascinating is that I just gave a couple of suggestions for resources, which you might be really happy that I suggested the Pain Reframed podcast. Actually, not just to a nurse practitioner, but also shared it with a physician on a random text. And she already listened to an episode and was so excited and really enjoyed, I don't know which episode she listened to, but was really inspired by that. And the person that I shared with at the pain office, she was writing all of this down and very excited to look at all this information. So I know you're doing education for mid-levels, maybe like nurse practitioners. Could you go into a little detail of why that's important and what you're doing?
Yeah, so Melissa, overall, you and I agree the whole world needs to learn more about pain. We're talking about the general population, we're talking about kids, we're talking about everybody, but also healthcare providers from the moment you walk into the front office. To be honest, we actually just got done with a study. We trained receptionists at physical therapy clinics. So, any person that spends time with a human being that hurts or is suffering need to understand how pain works. We have the innate ability as healthcare providers to either harm or heal with the words we speak. And so, I've worked with physicians my whole life, and I think that all of them, I wasn't smart enough to go to medical school. And the overall story I get is classic. I work with a lot of pain physicians. I work with neurologists, etc. They don't have that much time. I mean, that was never our intent, is for a physician to spend an hour explaining pain to a patient. But I need to be careful with the words I'm going to choose here, but as I always tell the doctors, at least the ones I work with, is don't screw them up. And what I mean by that is, we can use sometimes very scary words: torn, ripped, rupture, bulge, herniate, that induces fear. So we never had an intent to really make physicians the best explain pain specialists on the planet, but they obviously know what they're doing. They're excellent. But I'm very intrigued in the idea that people that do spend time with patients, and I have spent enough time to see that my physician assistant colleagues, the nurse practitioners, they spend more time than my physician colleagues. And so the idea was, why don't we teach them more about pain? Physical therapy we have trained, occupational therapy. So we've done a few studies. We went to a couple of PA schools, taught physician assistants, and shockingly, guess what? If you teach them about pain, their knowledge goes up. But they become more empathetic towards people in pain, which I find very interesting and exciting. Also, we found in a recent study, we haven't published it yet, is that when physician assistants are taught more about pain, they tend to pick more, let's call it biopsychosocial approaches versus procedural things like injections or drugs. So those are some of the avenues we're working. We did a big study in Minneapolis at a VA. We trained over 460 healthcare providers, including physician assistants, nurse practitioners. So there's that interest for us right now to train anybody that's willing to listen, that spend time with people that are hurting. And I don't know if in your case, I know you're super busy, but how cool would it be if you taught a patient something in the few minutes you have, and then the PA or the nurse practitioner says exactly everything you just said again, and then lo and behold, they come to see me in the PT clinic and I tell them the same thing again. That's what we're talking about here.
Right. Well, the continuity of the message, I think we all agree, is essential. And we all know that bad education on the front end, especially if it starts with the physician, it's really hard to to de-educate or re-educate someone with a firm belief from the first lesson they learned.
Yeah.
Do you mind going into, there's one other topic I'd like to touch on, and it was about the mapping studies when it came to back pain.
Oh yeah, so our research team is doing a lot of different types of education studies, but also we're playing lately with a lot of the mapping. We now know that in normal healthy people, when we map the brain, our body parts are very well represented. We know this is a hand, this is a foot, this is left, this is right. But the minute we don't move because we're in pain, we're afraid of pain, we're immobilized, or maybe a body part got removed, we know there's altered mapping. The maps for that specific body part may shrink or expand. And there is quite a bit of evidence to prove that this also contributes to a pain experience. And so within that, we have played with the idea that many of the things we do in therapy, which is often, more movement-based or touch-based approaches, may in fact enhance the mapping of the brain. So, we did a study recently. We took people with chronic back pain and we had them coloring where they hurt. And, body map drawings have been around since the day of medicine, right? Since the first day. And anecdotally, we just had people coloring where they hurt, and they would color in their back and their leg and their hip, etc. And then we would do some therapeutic treatments, either be it more tactile that we touched and did things, or more general movement-based stuff. We had patients redraw again afterwards, and then at their follow-up visits. And lo and behold, we were able to, with some software, take these bodies charts and scan them. When patients drew these maps before and after, we showed that the map shrinked. And the shrinking of the map was strongly correlated to reduction in pain and improvement from there on out. And so we find it intriguing because, again, in my profession, there's a big fight right now that they say pain science is either hands-on or hands-off. Meaning that it's either a cognitive intervention, let's go sit down with the patient and explain to you how pain works. It was nice seeing you, have a good day. Well, I'm a physical therapist by training, and so we do physical things. And so, if you look at the current best evidence for pain, and I'm very careful who I'm speaking to, but it's a combination of cognitive interventions, changing how somebody thinks, and movement, be it passive or active. And so we have shown that when we do some of these physical treatments, the mapping shrinks, and that correlates into a reduction in pain, which I find very intriguing. Obviously, if we had huge amounts of money to scan the brains, whatever, we could probably try and correlate to that. But I just find it intriguing that when we do treatments of patients, that these maps alter for the better, and they do correlate to a reduction in pain.
Right. I think those that have kind of dove a little bit farther into just going beyond their initial training in pain and the pain science and trying to keep up, we recognize, and I seem to say this over and over again, but there are so many different things that contribute to pain, but the question is what's most relevant to that individual. They're all important, all these aspects we talk about, and they all interact with each other. Just like, moving affects your brain, and what you do with your brain can affect your moving, and it's really hard to separate those things out. But speaking of moving with pain, can you discuss a little bit of what's coming up here soon?
Yeah, 36 days from now, we have the Align conference in Denver, Colorado, and yours truly, Melissa Cady, will be speaking for us as well. And so we're super excited. Every year we have a pain conference. We try and bring people together that are like-minded. We're thinking outside the box. We're thinking in terms of bigger movement strategies versus just injections and drugs. And so our focus March 8 to 10 in Denver, Colorado is moving pain, be it moving it societally or within schools, but also movement, obviously. Featuring a lot of different topics related to movement and exercise, but also moving the opioid epidemic, moving as a multidisciplinary team, which you're part of a panel we're super excited about. Just a fun weekend, and people get to different sessions. They can pick different sessions as a general session, and we have speakers coming from all over the world, and we're super, super excited. And we're excited, and numbers are picking up, and we're very excited to see people in Denver.
Great. Well, I promised a nice treat or a prize for those that are willing to engage and write comments or maybe bring up some questions or topics to speak about in the future. And if you are interested in a book, do you mind just mentioning a couple of the books that they could, if they're chosen by me based on their comments, that you would be willing to send them a free book?
Yeah, absolutely. I think the last time we sent people a copy of our new textbook, Paid Neuroscience Education. We'd love to put that out there. The Why You Hurt book, the Why You Hurt workbook. We have several patient and clinician books that we would be more than happy to pass on to participants in this program.
Awesome. Well, I will definitely look at the comments. So if you're watching this and you watched it to the end, feel free to list which book you'd like, and the comments or any suggestions for future reference and future discussions. And I look forward, Adriaan, to see you in Denver. And
Yeah.
thank you so much for your time and sharing your wisdom.
Thanks a lot. Thanks for having me on. And yep, see you in Denver.